Hey, good morning, everybody. Waiting for our YouTube channel to get started here. All right, hang on just a sec. There we go. Good morning, Peggy Berry Hill here, AGA in Wallala with Dr. Andy Cohen, and a couple of short announcements, and we will get started to talk about something that's still very important. In fact, it's so important that today from 11 to 2 at the Sea Ranch Supply, you know where that is, up Annapolis Road, there is a COVID vaccine clinic from 11 to 2. RCMS will have Moderna vaccines available for both first, second doses, and Pfizer vaccine for ages 12 and up with parental consent. So that's today. If you have not had your dose, your first dose, if you need your second dose of Moderna, or for youth 12 and up with parental consent, the Pfizer vaccine will be there. And the reason that we are talking this morning with Dr. Andy Cohen from Mendocino Health is because, Dr. Cohen, we still need people getting those vaccines, don't we? And good morning, first of all.
Good morning. It's nice to be here. It's the first time I've been on KGUA, and I appreciate the invitation to talk to people on the coast.
Well, great. Well, thank you and welcome for your first and probably not last visit. Yeah, the people here on the coast really appreciate it because, sometimes people on the South Coast here and the northern tip of Sonoma County feel kind of left out. But we've got quite a few people here. We're doing pretty good. I don't have in front of me, and I'm sorry, the time flies so quickly when you're getting prepared. Do you happen to have that latest statistics in Mendocino County on our vaccines?
Yeah, let me go through. I have
Great.
information on vaccines, but I also have some other important information I'd like to update the community about.
Great.
No, globally, United States and California wise, the number of people who are affected by this terrible pandemic and the positivity in testing has been coming down. Very nice. There are still hot spots in India, Brazil, Mexico, and here in the United States, the Midwest, Florida, and Arizona. In the United States, the cases are coming down slowly. The deaths are not rising as quickly, but we're still number one. India is running up close to catching up. It's not a good thing to be number one in this pandemic.
Number one, United States is number one in the pandemic. In
Yes.
which way?
Number of cases and the number of deaths. We're way ahead.
Yeah. Terrible.
So California has also been decreasing in all their numbers, and the test positivity, which shows how much viral activity there is in the community, is at its lowest since last summer. And the reason I wanted to start with all this is because right now, Mendocino is the exception. And that's very important. Our numbers have been going up. We're in a surge here. So you don't hear this on national or even regional, media or read it very much. And it's just been something emerging in the last couple of days.
Okay, I'm going to stop you right there because I think that's important to repeat. Yeah. Please.
So Mendocino is currently in a surge where we used to have 0, 1, 2 cases a day on average. And we were among the first of the counties in California to get into the least restrictive yellow tier. We have seen surges in counties around us, Humboldt, Marin, Shasta, and they're coming down. But Mendocino County in the last 2 to 3 weeks, our numbers have gone up dramatically. And so our case rate now is in the range of, let me pull this up, 6 to 7 cases per 100,000 per day. And our positivity rate, which the rest of California is 0.8, ours is between 4 and 5%. We saw between May 9th and 15th, 42 new cases. These are all unvaccinated people. So we have currently 55 people in isolation and 109 people who are in quarantine. And the deaths in our county have stayed stable for a number of weeks at 49. But after the numbers of cases go up, the numbers of hospitalizations and intensive care unit goes up, and that's what's happening in our hospitals. And after that, there's oftentimes, unfortunately, some people pass away as a result of the severe COVID. So we are in a surge, and I think that's something for all of us to take to heart. There are no outbreaks, but these seem to be related to a number of factors. Mostly it's individuals not masking the way they should be. We've been 14 months through all these restrictions, and it's frustrating for people. They want to be done with it all. Unfortunately, being done with it for everybody could mean some people getting very, very sick more than we need to. So there have been a couple of classrooms that have been shut down as a result of sports associated team infections. Again, not enough to qualify for me to call it an outbreak, but certainly clusters. People get very excited about their teams, and then after a game, they'll go out and they'll have a snack or a meal. And with the snacks and the meals, whether it's the athletes or anyone, we have to take our masks off, put that food in our mouth. And so that's where the germs spread quite a bit. The other thing is, in business, we've seen people gathering in their lunchrooms, lunch and break rooms, and not keeping their spaces. Again, those are areas where people often take off their masks to eat. It's better, if it's possible, to be eating outside, because the viruses, if they're there, they get dissipated much more easily. And then other people are not recognizing symptoms of COVID, and they're saying, well, this is a little cold, or it's my allergies, I have it every year. And they continue to work without getting tested. Once they get tested, which may be a few days later, and it's positive, we see that they've contacted, a dozen or 2 dozen people in the course of their work. And some we can never catch up with, especially if they're people who are working at a desk, like cashiers, people like that, where they're coming in contact with the public, and that's a problem. So, the county investigates all those positives, and occasionally we have people who don't even want to talk to the county about this, and that's a problem. It is important for people to understand that we do this in order to contain viral spreads and outbreak, and it's confidential. If we know from you that there were 3 or 4 or 5 or 10 contacts, we would call them up, but we would not tell them that we heard it from you. We would say, we have evidence that you may have come in contact with an active case of COVID, and we'd like you to get tested and remain in quarantine until we're sure that you're safe. And that's the way we contain things. And if people need support, the county can certainly give some support in terms of food and even housing if it's necessary, to maintain those quarantines and make sure that we contain them and mitigate those potential outbreaks.
Okay, well, yeah.
I'm sorry.
I was just going to ask you to take a break there. If you just joined in Peggy's Place, you are listening to the voice of Dr. Andy Cohen from Mendocino County Health Department, and he's sharing some information that to me is fresh and a bit alarming. I thought we were doing much better here in Mendocino County. He says we're actually, and of course, correct me if I'm wrong, but I believe I heard you say we're having a surge here of cases, and the reason partly is because we've gotten very relaxed. We have heard the mask and vax, they're very similar. The mask mandates have kind of, they've sort of been softened. And I have to admit, I'm one of those people. I'm double vaxxed. And a lot of times I'll see a friend my age who I know has been double vaxxed, and we will not have masks on, and we'll meet and even hug. Hopefully, we haven't been going around spreading anything. We even had, on Friday, we had a fund drive here at the station, and people would show up the door, masked generally, and, hand us a check or something. We had quite a few people here, including a 6-person band who he performed for us in the studios, far away from us, and I don't know, maybe 3 feet away. We don't have eat from each other. So even we are guilty of relaxing a bit too much. And so it's really good to remind people. And I think the other thing that people might have relaxed on is the old-fashioned washing your hands. That's really important. So continuing masking, washing your hands, and social distancing, it's very, it's so easy to become relaxed. But the thing that really is uh, concerning the most is this weekend is a big holiday weekend. We can tell you already that, the hotels, the motels, everything, the beaches, the parks are filling up with people because this is the first time in a year and a half people have felt like they could get out. And so on a typical weekend before COVID, we could see as many as 24,000 people out here. I don't think we're going to see that many this weekend, but there's going to be a lot of people here. What should we be doing?
Well, you're right. There has been some relaxation of rules, but it's for the vaccinated people. And that's the advantage of getting vaccinated. The president and the governor have made statements in the last few weeks that have led to a lot of confusion. But the California Department of Public Health is holding fast at this point until June 15th to just allow everybody to go without masks. So it is important if you are not vaccinated, first of all, to get vaccinated. Second of all, frequently get some testing to see if you're carrying it or been exposed. But also, as far as gatherings go, that's what happens, and it's going to happen this weekend, is to maintain
Mhm.
your masks. I know it's a pain. Nobody likes it. Everyone wants to get done with it. It's 14 months already. We're sick of it. But it's better to be sick of a mask and get a little steamed up in your mouth than have to wear a respirator in a hospital. And I don't think anybody of us would wish that on a neighbor or a friend, especially somebody we're gathering with, to have a good time. We don't want them to go back and 3 to 5 days later, they're in the hospital, they're on a ventilator or something like that. So for people who are not vaccinated, they really need to watch and continue to use their masks if they're outside in groups of people, if they can't maintain their 6 feet distancing, and inside all the time unless they're eating. And eating is best to be done outside. And if they are not masked, they should really be 6 feet away from anyone. Playing of music, bands, and that sort of thing is a little bit of an exception. We like them all to be using their masks when they are playing and singing. And there are special masks that they can get for playing even wind instruments. And then for the bells of those wind instruments, there are actually little masks that go over the
Oh
bells.
my goodness.
Yeah, and it's very effective because otherwise that kind of activity can certainly spread it. But if you're in front of a band or they're playing for you, there should be at least 12 feet of distance, not 3 or 6 feet, but 12 feet. These viruses are not mystical things. They're little particles and they travel. And it depends on where they are, how much they travel. It depends on the ventilation. And that's why outside is much safer than inside. And inside, if we have the ventilation, the windows and doors open, that's safer than having them closed. And the thing is that people can come to an event and not have their masks on because a lot of other people come to a small event without their masks on. And you don't know who's vaccinated and who's not vaccinated. And so it's really up to people who've chosen not to get vaccinated, or they're not completely vaccinated. That is, 2 vaccinations, however many weeks apart, or the one of the Johnson Johnsons, and then a week after they're finished with their whole series, 2 weeks after they're finished with their whole series, they're considered fully vaccinated. But if people are not fully vaccinated, they should be protecting the people around them by wearing a mask, and they're also protecting themselves. So we should continue, especially in this time of a surge in Mendocino, and you did hear me correctly, this is a surge. And luckily we have in the range of half of our population who is vaccinated now, where we didn't have any vaccinated last summer. So hopefully it'll be contained. But if we're in a surge and it's contained, that might be cool for the statistics. It's not so cool for the individual who gets sick. So for all of us, we should be protecting those people. And we don't know whether that person might carry it to their elder in their family or a friend who's really vulnerable and they get sick, terribly sick. So we need to control this as a community activity, and it's very important for us to do that.
You're listening to Peggy's Place this morning. You're listening to the voice of Dr. Andy Cohen from the Mendocino County Health Department. Very important update on the vaccinations in our Mendocino County. We're talking very specific right now, very local. The fact that we are in a surge, which I don't think any of us really realized. And I want to follow up on several of the points you just made. One, let's be clear, because I hear people get confused about this often, and well, I'll just spill it. If you have been vaccinated, you are not going to be passing COVID out to people.
Correct.
Okay, so see, that's simple. Get vaxxed. If you have not been vaccinated, you may get sick. You may be passing the COVID virus around because, as Dr. Cohen said, it's in the air. It's these little particles. Imagine illuminated dust particles that you could see everywhere. That's where it is. But let's talk now a little bit more specific about the age groups in Mendocino County that are not being vaxxed, because as I understand, it's skewing into the younger age groups. And some of that is because in terms of the youth, 12 and up, those vaccines have just been released. But there's also, I would say, up to in the 30s that people are not getting vaccinated. So let's talk about that.
Yeah. That's true. And it's, of course, we understand the younger people haven't had a chance to get their vaccines yet. Everybody over 12 can, and we're trying to do that as quickly as we can. But the group that we've continually been the most concerned about and have had the most infection in our community are those people from 19 to 39 years old. They're working people. And that may be part of the problem. They can't get off work in order to get their vaccine. They may be afraid if they get a vaccine, they're going to have their arm ache for another day or two. But boy, it's a whole lot better to take that time off. And if you've got in health insurance or sick days, in most of the large companies, you can get paid for that time. So if you've got a little bit more than just a little achy arm, but a significantly achy arm, and you have a headache and you really can't see going back into work, then sick pay and even disability can be applied to those days. So that group from 19 to 39 years old really needs to push on getting the vaccines. Now, many of those people also don't get time off. There are essential workers. They are the people we've been trying to protect them, because protecting them protects us. It protects our food supply, it protects the restaurants, it protects the maintenance and housekeeping and all of our businesses and lodging and that sort of thing. Those people, if they can, and it could be their employers can't require vaccinations at this point, but employers could remind people, hey, have you been vaccinated? Or if you haven't been vaccinated, please let me know you have to take this time off to get vaccinated when the vaccine clinic is open, and really encourage people to do it. Some people just haven't taken the time because they just didn't know when the vaccines were available and they could be available. It's hard to coordinate. Some don't have transportation. And some are anti-vaxxers, but not all. A lot of them are a little hesitant. I think for the ones that are hesitant, they need to know that hundreds of millions of these vaccines have been distributed to all ages, and except for the ones under 12. We don't know about the ones under 12. The research is being done, so I don't want to spread this too loosely around, but for the research that's been done, it's extraordinarily safe. Compared to other vaccines, it's really extremely safe. And it's very, very, very effective. The illness that we're seeing in the county is all unvaccinated people.
Again, Dr. Andy Cohen, thank you so much. I want to remind people today, Wednesday, May 26th, from 11 to 2 at the Sea Ranch Supply off Annapolis Road in Sea Ranch, there will be a pop-up COVID vaccine clinic. And there will be Moderna vaccines for people who need either your first and or second doses. Pfizer vaccine for ages 12 and up with parental consent. Here's a chance to do that today. Walk-ins welcome, no appointment needed. And we thank Sea Ranch Supply for allowing that because, again, maybe a lot of essential workers are going through Sea Ranch Supply to get supplies. And it's, it's in between. It's in Sonoma County and just across the bridge here from Wallala. So there are a lot of vaccine clinics that are popping up everywhere to get the rest of the people in Sonoma and Mendocino County vaccinated, and especially those young people. Now, I want to share a couple of, you brought up concerns. I saw a post on Facebook this morning where a woman had gotten a rash after her vaccine. She doesn't know if it's related to the vaccine, but it might be. Other people, of course, some people have complained about, other than the sore arms, because it does. Your arm feels like it weighs about a ton, but some days, but it's very short lasting. But the other people who might be getting hives or headaches or feeling nauseous, what should they do?
Well, understand that 99.9% of those
Right.
side effects are expected, and they're good. They show us that your body has taken up this antigen and has taken the warning and is building its own immune resistance to the whole germ when it comes on board. These vaccines have they have a little tracer of what the virus actually is. So it's like, if the gun is the enemy, the muzzle of the gun only, and not the bullets and not the trigger, are being given. And so you see a muzzle of the gun, you see the antigen, you make an immune globulin to it, and you're able to fight it. But that immune response itself causes some rashes, definitely causes some pain and swelling at the site of the arm, at the site of the vaccine. It can cause some headaches. It can cause some just general feeling of, oh my goodness, this is terrible, like a mild, or it can be even a more severe flu-like syndrome, but for a short time. And making sure you're hydrated, get the rest. You can use some Tylenol or Advil for the more troublesome discomfort that happens, and just wait until it's gone. And nearly all of them are gone in 3 or 4 days.
Okay, so that's really important to recognize, folks, that your body is doing what it's supposed to do. It doesn't mean that there's something wrong with a vaccine.
Right.
It means your body is reacting as it should to protect you. So I think that's very important that people need to keep that in mind because of the fears that might be out there that some reason there's something wrong with whichever vaccine it is. And what is the difference between the Moderna or the Johnson or the Pfizer? Are there really that much difference between any of them?
The Pfizer and Moderna are unique and novel types of vaccines. They've been used in other situations. They've been used in outbreaks for years, actually, in Africa and in some other areas. It's a type of making the vaccine. The Johnson and Johnson that had so much adverse publicity is actually an old-fashioned type of vaccine that's very effective. And even though it got terrible publicity for the side effects, compared to other vaccines, it's extremely safe. That's why, after reviewing the side effects, these brain clots and other clots that happen, the FDA and the CDC and all the bodies here in the United States and in Europe, they said, no, you know what? It's really a minimal serious side effects. They're terrible if you have them, but the risk of those things are so small compared to the good that it does that it's worthwhile to continue vaccinating, even with Johnson & Johnson. So, I've recommended women under the age of 50, between 18 and 50, which is the vast majority of these clotting type of side effects. They should avoid it. They should get the Moderna or the Pfizer vaccine. Other than that, the other people who could get the Johnson & Johnson, it's one shot. There aren't the same kind of allergic reactions that have happened with the Moderna and the Pfizer. But even when you look at the Moderna and Pfizer, they're not that significant. So from one point of view, understand the old-fashioned way, the Johnson & Johnson way of getting that. I was making an analogy to the muzzle of the gun. So we make our protection against that. The way they do that is with using another virus that is alive, but it's been attenuated so it doesn't cause disease and it cannot cause disease. And that's part of the research into developing these vaccines. So they put this little antigen into a virus. The virus goes in, releases the antigen. The body takes up the antigen, actually makes a little bit more of it to recognize it, and then develops an immune reaction to it. That's how that works. And many of our childhood and other vaccines have used that technology. And so it's a safe technology. And the nice thing about, to think about the side effects and some of very terrible side effects that have happened is that for the numbers that it's happened with, we're able to figure that out quicker because of this vaccine adverse event reporting system that they use in the United States. So even after it was 18 events out of millions and millions, they were able to stop it, study it, research, look at the data from Europe as well, and say, hey, you know what? We'll continue watching this, but it looks like it's a minor but severe, a very infrequent, extremely infrequent side effect. You should use it. So the advantage is we do look. We don't arrogantly say, oh, this is safe. We keep looking because after you've researched it with hundreds of thousands of people in a research environment, then you keep looking at it when it's into millions. So one thing is the safety of all of our vaccines are closely watched. When you get to I'm sorry, you wanted to say something. So
well, I do. I just want to be clear. I'm just amazed at the figure you just raised. 18 out of millions of doses caused the clotting of one.
Yeah.
And which one is that for people? So I'm thinking of a dear friend in particular who's about my age but has clotting issues. What would be the safest vaccine?
they should talk to their provider
Okay.
because their clotting issue may not. There are many issues with clotting. It's a
Okay.
whole science and a whole specialty. So it really depends. But one of the side effects with the Johnson & Johnson was they found that there was an inflammation that actually affected the clotting particles that we have, the platelets. And paradoxically, that would have ordinarily, you'd think, caused bleeding. Paradoxically, it actually caused some clotting because it was an inflammatory reaction. And it was an unusual type of clotting in the basilar vein of the brain. And that's why you had things that were strokes, basically. They were not the typical kind of strokes, but they're strokes, and they're terrible. We don't want to play that down. But it happened in 18 people. And since the research and keeping on looking at that, there have been a few more that have been uncovered, but it's still an extremely low percentage of people who are at risk. So anyone who has a concern about their clotting, they should talk to their provider to get a clearance. But for the most part, clotting problems are not an issue, even with the Johnson & Johnson vaccine. That's a very special inflammatory problem that occurs very rarely, and it can come along with clotting. And so that's that one.
Okay. Time to remind you again, you're listening to Peggy's Place here on KGUA in Wallala. You might be listening to us on the internet at kgua.org via the Air Pocket app, via the TuneIn app, or radio.garden. We're also on our KGUA YouTube channel talking with Dr. Andy Cohen right now. Very important, particularly for those of us right here in Mendocino County and the northern tip of Sonoma County too. But focusing on Mendocino County, everything relating to COVID-19, the need for vaccinations, why it's so important for you to get those vaccinations. And what Dr. Cohen said to me was breaking news, was that we're in a surge here in Mendocino County. I had no idea. And so I too will urge you all to continue to mask, wash those hands, and, just be careful around everybody, that particularly those that are vulnerable, and make sure that you're getting those vaccines. And again, I'm going to say pop-up vaccination clinic today from 11 to 2 at the Sea Ranch Supply, which is in Sonoma County, actually. It's across the bridge, but it's open to everybody. Walk-ins welcome. And so important. And our local clinic, the Redwood Coast Medical Services, has done an amazing job of getting people vaccinated, as have the clinics that have been showing up also in the northern part of Mendocino County. But we're a vast county, not so many people, but it's huge. And I think therein is part of the problem as well, as you say, for those essential workers to be able to get to the clinics. You know, I saw something, this is just an aside, but I was watching the news this morning, and in Florida, you know, if you go to a restaurant that's really busy, you find the wait person coming out with their arm with huge 3, 4 maybe plates on them. It takes a tremendous amount of strength to do that. And so there is this new invention of this little robot that has little shelves, and the wait person stands at the table and the robot brings the food out, so that you still have a wait person, and the wait person can then put the plates out. Well, maybe it's just me, but you know what my first thought was? Well, how do I know somebody hasn't sneezed on the as that robot has been passing a table or something, thinking about COVID? Anyway, that was just one of the first things that came to me, thinking about the era we're living in now. So I don't know, maybe they'll be covering them, but this was just an example of something that, it's not to take away jobs, folks. It's about helping those workers not have to carry. If you've ever been a waitress, you would know, or wait person, how heavy those plates are to come out with a smiling face and pass them out to people around the table. So anyway, I just thought those concerns to me about open air, and should we be concerned about in that way about open air and foods, whether it's shopping or at a restaurant.
Now, open air is actually much healthier
Good.
from the point of view of COVID, for sure. Fresh air, and there's much less likelihood of the COVID virus to accumulate in that kind of an environment. And so it's healthier. That's what we want people to do. If they if they're outside, they can, and they're maintaining their distances, they can be a lot less concerned about masking, unless they're in crowded areas. So we want to emphasize that distance is also important, because these viruses are particles, and they flop down to the ground. So open air is good. It's good for our mind, it's good for our body, and it's good for our lungs. So keep that.
Well, I just wanted to remind people, Dr. Cohen, because they might have missed the first part of the show, and talking about, since this is a holiday weekend coming up, we're going to have 4th of July, we're going to have all of these things, and people are just, we all know, boy, we all felt such a release over the past 2 weeks, I would say, feeling like we didn't have to wear our masks all the time, and other things that have happened with our country. We're starting to feel a resurgence of energy and strength and camaraderie coming back. So we don't particularly want to overdo it, but if we're going to do it, we want to do it right. And so once again, I know you've told us this already several times in this short time we've been together, but again, remind people how to gather safely.
Yeah, so make sure that if you're not vaccinated, the gatherings really should be outside, and for short times, 2-3 hours. And really, it's better to not be serving food if you're not vaccinated. Anytime you're serving food, there's much more of a risk of transmission, because you have to take off your mask, food or drink. If you are serving food, they should be individual containers. So it shouldn't be, like everybody scoops their own food, because that's much more of a risk. And you should have arranged for individual containers of food to go out to people. But it's best to not serve food. If you're unvaccinated, you want to maintain your 6 foot of distance, and you want to have your masks on all the time, unless you're eating, and then make sure you're 6 feet apart. If you're vaccinated, the rules change quite a bit, and that's one of the reasons why we're recommending vaccination. If you're vaccinated, then you can actually have some gatherings indoors. You can be outdoors at a restaurant with friends from multiple households and not wear a mask. You can have a small outdoor gathering with fully vaccinated and unvaccinated people And if you're vaccinated, not wear a mask. If you're not vaccinated, you should be wearing a mask. And an outdoor gathering with fully vaccinated family and friends, everybody, because they're all vaccinated, can go without a mask. And of course, you can walk, run outdoors with members of your household and wear a mask and not wear a mask. And so at a gathering, you can be indoors, and not wear a mask if you're vaccinated. So that's very important. But you want to maintain those distances. If there's musicians playing, they should be 12 feet away. And if they can be masked, including the wind instruments masked, it's the safest to be doing. And then wash hands frequently. The other thing is traveling. A lot of times people will carpool, come by bus or by car with a number of people who are not from your household. Keep the windows open, keep the masks on, because that's a closed space. It's easy to transmit viruses. That's what I would say to keep in mind. Certainly outdoor areas, whether you're vaccinated or not vaccinated, if they're crowded areas, for example, if you're traveling and you go to a bus hub or an airport or something like that, or downtown or in a concert where there's just a lot of people bumping around, outdoors or indoors, you can catch the COVID. So if you're not vaccinated, you should have a mask on. And in general, in those kinds of crowded environments, even if you're vaccinated, wearing a mask is kind and it's appropriate, because who can tell who's vaccinated or not? The rules will be everyone should be vaccinated, for example, in an airport, in a bus station, those kinds of things.
I just had two friends here, actually two people who are on KGUA regularly. Scott and Tree Mercer just left our coast and went to their home in Maine for a couple of months. And conversely, a friend who from here in Anchor Bay had already been living in Alexandria for 6 weeks and came back. So they sort of going across the nation. And what they saw was very few people wearing masks. And they also ran into some minor antagonism for wearing the masks, because they were all being very, very careful. So there is that element as you're traveling. What advice do you have for people who are traveling and they, when you might run in a situation that might get uncomfortable? What would you suggest?
Well, that's a great question. In the state, if you're vaccinated, you can, like I said, if you're in areas where there are many people or in closed areas, going by bus or car with other people who are not in your, in your household, it's best to take the precautions of masking, keeping distance. If you're vaccinated, you can even still take those precautions. It's safer. Remember that there are variants out there, and we're seeing more of these variants that spread very quickly. So going in and out of areas can transmit those variants. Within the state of California, you don't need to test before you travel. You don't need to quarantine when you return if you're vaccinated. If you're not vaccinated, then there are some restrictions. But let me just say this also: if you're sick, if you have symptoms, don't travel. Because you may have COVID and you'll spread it around to people you're traveling with, or the people who you don't want to give it to, who you're visiting, you love, that's why you're traveling. If you're sick, don't travel. If you're out of state and you're vaccinated, you don't have to test before or after or quarantine. But going out of state from California or coming back from California, if you're leaving and you're unvaccinated, you want to test 1 to 3 days before and make sure you're negative. And that can be done at the clinics, and there's some other areas that people have that have testing stations. So test before, and when you come back, before you get on your transport or whatever, get another test. And that may be required in order to get on airplanes and stuff like that. But when you come back, 3 to 5 days after you come back to California, you're required to test, and you're required for the first 7 days you're in California to be in self-quarantine. And if the test is negative after 3 to 5 days, you continue to monitor, you continue to quarantine for 7 days, and then you monitor for symptoms for 10 days. If you're unvaccinated and you don't test, you have to be in a full quarantine for the full 10 days. So again, if you're unvaccinated, there's a lot of more restrictions. If you're vaccinated and you're traveling within the United States, you don't have to test. You don't have to quarantine. If you're not vaccinated, you should test before and when you come back, and quarantine, for 7 days, 10 days if you haven't tested.
That's such interesting and important information, as we do know people are starting to travel and take those airplanes. Also had a friend who went to Hawaii, and Hawaii was very strict about being tested within so many hours before getting on the plane. And I think arriving in Hawaii, and I don't know about returning, but very, very strict about letting people come to Hawaii. Other states, some states just have no restrictions. Other states do have, although they, nobody's asking you to show your card that you've been vaccinated. I got mine laminated and carry it with me, but
or take a
perhaps
picture of it on your smartphone.
There you go. There you go. Or maybe you're going to go visit another state, and you have a loved one in a nursing home, nursing facility. Whether or not they're going to actually let you in, if you're a family member or not, is another thing. Now, a lot of us go to the optometrist or the doctors, and we get those, they shoot that little thermometer at us and of course ask us all the questions. Have you been sick, and all of those things. So how effective is taking the temperature?
Well, the temperature is less sensitive than we thought it was. But people should look at their symptoms, and really shouldn't go to work if they have symptoms. They shouldn't go into, they should let their doctors know, or whoever it is that they're visiting, if they're having symptoms. And we have always, done a self-questionnaire before we went into places of business. There'll probably be less requirements when we get beyond the blueprint after June 15th, but there'll be recommendations. And I think that we should all be aware, if we have some symptoms, we shouldn't assume that they're allergies. Take an allergy pill, the non-sleepy allergy pill. Make sure you're not having symptoms, and then you can go about your day. And it still wouldn't be a bad idea, certainly if you're not vaccinated, to get that nose swab to get tested.
And that's so let's go back to that point. And I really appreciate you giving me all this time this morning, and giving our listeners all this time, because the real key here is we want you to get vaccinated. Just go to those clinics like the one today up at the Sea Ranch Supply from 11 to 2. They will have the Moderna vaccines for first and second doses, and the Pfizer vaccine for ages 12 and up with parental consent. And don't forget, you have to wait, is it 2 weeks or 3 weeks in between first and second doses? I can't remember.
If it's Moderna, I'm going to get it confused also. But I think if it's Moderna,
it's at least 2 weeks. I know that.
It's 3 weeks or 4 weeks. So I think
Yeah.
that Pfizer is 3 weeks and Moderna is 4 weeks. And then it's 2 weeks after your second shot, and then you're fully vaccinated.
All right. So when you get shot, they will tell you how long. And they also ask you to sit for 15 minutes usually, just to make sure you're not having, I don't know what, dizziness or any kind of thing popping up.
Dizziness or more serious allergy reactions. So there are allergic reactions that can happen. And if you've had severe allergic reactions to vaccines in the past, or to other components of anything, very severe reactions, anaphylaxis, you should let people know that you're getting, that who are giving you the vaccines, that it's a possibility. And we watch you for 15 minutes just in case, but we watch for 30 minutes if you've ever had a severe allergic reaction to a vaccine, or to pineapples, or anything else you may have had. So if you've had a severe reaction, then you should let the people who are vaccinated know.
I haven't seen any kind of statistics. Do we know if there have been any people who have had any severe reactions? In our county? Yeah, allergic reactions.
I think there was one. Yes, there was one or two.
One.
They were usually able to be treated right on the spot with appropriate medicines, which our vaccinators all have. And for the most part, there's actually an ambulance that's there at almost all the
Mhm.
vaccinations. So yeah, we're
One,
prepared for it.
one or two, that is awesome.
Yeah.
Again, we're talking with Dr. Andy Cohen from Mendocino County Health Department about the importance of getting vaccinated. That he broke the news this morning. If you just joined us, that I'm calling it breaking news because I hadn't heard this, that Mendocino County is in a surge. So the importance of getting vaccinated, but also talking about how really safe it is. And talk with your doctors, obviously, before if you have some health concern. But for the most part, these vaccines, and you're probably a little bit younger than I am, but I remember the days when we all stood in line for the sugar cubes. We all stood in line and got those smallpox vaccinations just all over the nation, measles, all of those things. And we don't have those in the United States now and in most of the world.
Right.
So that shows the effectiveness of these and why, we don't think of the danger of measles anymore. We don't think of the danger of all of those things because they're not here. So there's a reason. And then with this one, that's just brand new and it's happening all over the globe. That always just, when I think of that we're all going through this together at the same time all over the world. I mean, it's not overwhelming, but it's like we're all humans. All right, this is one planet. This really shows we're one planet,
Right.
more than anything, and to me anyway. So it's so important. So, what have we not covered here? We've got about 10 minutes left, and if you don't mind sticking with us, I'd like to continue to ask you questions. What else do we need to be thinking about?
Well, you had asked me about the different vaccines, and we talked about the Johnson & Johnson that there was a lot of hullabaloo about a month ago, and we didn't, I think, cover Pfizer and Moderna, which are the
Okay.
new types of vaccines. Like I said, that type of vaccine has been used for the Ebola epidemic in several places in Africa. So the technology is not brand new, but it is brand new in the United States. And it was amazing how well it worked. So think about this. It usually takes years to develop a vaccine. It took less than a year to develop a vaccine and get it started to be out to people for these two. And the reason why is because they're not using other living organisms to inject that antigen, that part of the virus that we can defend ourselves against, and that is very effective at defending ourselves against the virus. What that is reproducing just that little part of the virus, and then that goes into the body, and the body reproduces it and then makes its own immune reaction against it. So there's very little that you need to do worry about in terms of any virus that's carrying it or bacteria we use to carry it, that they can cause an infection. There's no way this can cause an infection. It's a chemical, in essence. And
Wow. I got to stop you there. I love science and I love what you've just said, because I think that also there's still a lot of people, even after all this talking, thinking that when I'm getting an injection, I'm getting a big jolt of that COVID virus thrown right into my body, and that's not what's happening. Oh, wow. This is so interesting to me. I hope it is to you in the audience too, because science and how far we've come is just awesome to me. That I really appreciate hearing that.
yeah. So what's being injected is a little blueprint of the antigen that the body makes the antigen and then makes an immune response to it. And the immune response is very powerful. It's nearly 95% effective. And it's been used now in all age groups, except for the under 12, and in all racial groups around the world. And it's very effective and very, very safe. So, that's why it's been picked up and it's been used so effectively around the world where we have it. And it's used effectively mostly in the United States and some of the rich countries of the world. One of the things that we're dealing with now is we've always in the United States been dealing with the disparity between, the whites and the well-off versus Latinos and Blacks in particular, who have less uptake of the vaccine, less opportunity for it. And now we're really focusing our efforts on that and have been throughout the vaccine effort. But now, of course, people are reading about the disparities around the world and the terrible epidemics that are happening in the Far East, in India, for example, or in the south of the planet, South America, Africa, and so on and so forth. So we're trying internationally to create a fund that the United States and other of the wealthier countries had contribute to making those vaccines available to people around the world. And so that's an important part of it. We still need to focus in our own country on the people who are the most affected, our essential workers, who are mostly minorities, and we need to focus on getting them the vaccines at this point.
I think you're in terms of essential workers too, and I must have to add Native Americans, since I'm Native American, and we do know how the Navajo reservation, which is vast, it's in parts of 4 states, was hit so hard, but they were also the first, as I understand, to now have herd immunity. But in lots of parts of our nation as well, rural people may have a hard time getting to those clinics and some of those essential workers. I saw some urban area is giving discounts on Uber, which still sounded like a lot of money to me for a lot of people to have to get to a clinic, but the importance, it is there. Or I think about people in Alaska who are so rural as well, and still have a lot of snow there to get through. So, there's all of those things that have to be met that we don't think about. And right here, we've got it pretty easy. Just going up to Sea Ranch Supply this afternoon. If you haven't done it, go on up there between 11 and 2 and get your vaccine, whether it's your first or your second. And this is Moderna. And for those 12 and up with parental consent, it's Pfizer. But yeah, that's another reason I think some of the numbers, and particularly in Mendocino County, it's rural. How are you going to get there? But global as well, when you're not in a city and don't have access to some of the places that you could get these vaccines.
And Mendocino County is beginning. We're asking, partners, our business partners, to offer some rewards, and at least over in Ukiah and I'm pretty sure Fort Bragg, we're being able to offer some rewards, especially for the 12 and up for the kids. It's been reward cards to coffee shops or to boba, to donuts. We've gotten some donuts donated. And the other thing is game cards. We have some game cards from GameStop in Ukiah, and they're going out like hotcakes, as they say.
I bet. I
So the
bet.
kids love them. Yeah, and we're trying to do that. It's important. Whatever way we can get the community vaccinated, we're learning from other counties. We're getting our business partners to do more and more, and we're trying to get those vaccines out to everybody so everyone is protected.
Let me ask you something, if you don't mind, and you don't have to answer if you're not comfortable, but on a personal level, what have you learned from the COVID epidemic?
Well, I have learned, and I think it's been very profound for me, that when we come together as partners, we've been able to do some great things. The County of Mendocino, working with our clinics and our hospitals. Now the pharmacies are having vaccines available as well. We can get these vaccines out in record numbers, and we work together to do it. And so that's one of the things that I've thought is a really excellent outcome, let me put it that way, of this year of being closed up and so on and so forth. So that's one of the things that I have learned, and I would spread that around. It's not comfortable to wear those masks. And people realize how important it is to be together and how much they love each other. And they don't like those masks, but they don't like them, some for whatever reason, but some because they don't want to have their face covered. They want to talk to other people without their face covered. And so, but they're willing to wear it because they care about the other people. So, in medicine, we wear the mask all the time to protect against infection, but also to protect against passing our germs to other people, for example, in surgery. But that's not the usual thing in the American culture. And now people understand that that little bit of discomfort of wearing a mask is so essential for the people around us, our loved ones, and their lives.
Now, I'm going to go one step further. What about you personally? What did you find that maybe you've missed in this past year and a half?
Oh my gosh, I've missed a lot of sleep working as a health officer.
That's okay. That count. Yeah.
Yeah,
Yeah.
no, but the difficulty getting together with friends and relatives, loved ones, has been a real heartbreak. That's one of the things I really like to do. Um, you know, not being able to go to some concerts and festivals, those are things I like to do. Being closed up has been very difficult on getting exercise. And I put on my COVID belly. That's not been a happy thing. I'm going to try and work that off this summer.
Right.
But all those things it's been a change in the world. It's really been a change in the world.
Well, Dr. Cohen, thank you so much for joining us. And I can't help but have hope as you were talking about the mechanics of these vaccines being so different, that someday we're going to have that for cancer. Someday we're going to have that something. I'm a 8-year survivor of cancer myself, and which I never would, it's a terrible thing to have to go through. Hopefully, maybe someday we'll have something that simple if we just knew what turned it on, and we have
Right.
no idea what turns it on. But in the meantime, get your vaccine, please. And let's let Dr. Cohen get some rest here. And big smile on his face. And thank you again for joining us. Join us again anytime you want to give us an update on this, because you have really educated our audience, I believe, and myself even more. It's like we learn more about COVID every day. And we're making some gains, but not enough. That's my words. To bring safety to all of us. So get vaxxed, wear your masks, wash your hands, and thank your doctors.
Thank you. Thank you.
Thank you. Take care. Good talking to you. And by the way, doctor, this repeats at 1 o'clock on KGUA, and it'll also be on our KGUA YouTube channel, so you can share it with your friends and colleagues around the world.
Thank you.
And so you take care and come back again.
Okay. Thank you.
All right.